So tennis elbow is a very common condition that we see here in the Vail Valley. The medical term for it is lateral epicondylitis, but it's very commonly known as tennis elbow, and it's not just in tennis players, it's in all athletes and just workers and people that live life gripping things, which includes pretty much everyone. Wide grip is very common for triggering the symptoms of lateral epicondylitis or tennis elbow. It's very commonly seen in patients that are 40, 50, 60 years old, sometimes in the 30s. We rarely see it in younger patients. So the typical presentation of lateral epicondylitis or tennis elbow is pain on the lateral aspect of the elbow. And you can very easily palpate the epicondyle, which is this bony prominence. And typically when we palpate in this area, the tendon that runs to the forearm that lifts up the wrist like that, that attaches right there. And if you press right there, that typically causes a lot of pain in patients. The other thing we'll ask them to do is to lift their wrist, and then we'll fight them like that and push. And if that creates pain in this area, then it's almost always lateral epicondylitis or tennis elbow. So the first line of treatment is always conservative management. And conservative management for tennis elbow can involve stretching, icing, sometimes physical therapy, and activity modification. So if there are certain activities that you do that really hurt your elbow, then we try and avoid that as much as possible. And we try that usually for 6 weeks. And if that has not worked and is really bothering patients significantly, then we move to the second line of treatment. And that often involves a possibility of a small injection. And with this small injection, it's a corticosteroid, which is basically a liquid anti-inflammatory medicine, and we place it right in the area where the inflammation is. And it can be surprisingly effective. The literature states that 90% of patients with conservative treatment will resolve this condition within 1 year. Expectations with tennis elbow are notoriously difficult, meaning that I never know when I see a patient and let's just say it leads to an injection, and I do the injection. It very predictably takes care of the pain. Usually within about 24 hours they are completely pain-free, and that's exactly what I experienced with my own tennis elbow. But the expectations is difficult because sometimes the one shot will break the cycle of inflammation and we'll never hear from the elbow again. And other patients in 3 months or 6 months, slowly but surely it'll just set back in. Now, once patients get to about 3 injections, then we sort of move from the second line of treatment to the third line of treatment, where we think instead of just inflammation, it's more of a repetitive micro trauma that's actually torn some tissue there, and specifically torn the tendon's attachment onto the bone. It attaches right on the bone here on the outside, and the tendon can slowly but surely tear there. It has very poor blood supply, and so it's a very slow healer. And if patients have gotten to 3 injections and they've already tried icing, anti-inflammatories, physical therapy, stretching, and activity modification, then we suggest possibly an MRI to look at that anatomy. And if it's torn, then sometimes it requires surgical management.